a child, those things are not available to the poorest in the world, and yet they can be done very inexpensively. And so over the last 15 years, we've made a lot of progress getting those tools out to all the people who need them. Death rates have come down over 40%, but we need to get it down far more dramatically, and that's my life's work.
Mm. And then there's another very horrifying figure, I should say. 19,000 children die every day from different kind of diseases all over the world. That's also a staggering big picture, isn't it?
Well, again, the number was 12 million back in 1990. We've got it down to just about 7 million now. And so a big reduction. We have some new vaccines coming along that'll bring it down even more. But it's one of those tragedies that doesn't get talked about enough because it's happening every day.
You know, very quietly in a way.
In a way, yes. And yet it's more than all the earthquakes and plane disasters. You know, it's 100 times more than the things we read about in the news. And yet there's a parent for every one of those children. And the tools that we take for granted can prevent most of these diseases.
Mm. What is it that makes you so interested in? How did it start? Some kind of epiphany that got you started?
Well, I've always been a big believer that we can innovate. And, you know, I saw that in software and computers. Then the question was, can we innovate for the people who have the greatest needs? Or are we just doing it for the rich? And I learned a little bit about that and realized that we weren't applying ourselves to the needs of the poorest. And I decided to make that my second career. It's my full-time foundation work. My wife and I are very dedicated to that. And it's been very fulfilling, easily as fulfilling as the software work, because we are making progress, even though there's a lot yet to be done.
Hmm. Prime Minister, if I can turn to you, it sounds like the old American slogan, saving the world one child at a time. Is that how it works?
In one way, because I think that a very impressive aspect with what the Gates Foundation is doing is that they are so focused on results. And that's also the reason why Norway has cooperated so closely with the Gates Foundation. And for instance, in the work to immunize children, which is the most effective way to save lives, to reduce child mortality, the way we have moved forward together with the Gates Foundation is to pay per child immunized. And by doing so, we have been able to achieve this enormous reduction in the number of children who die before the age of 5. But still, there are too many children who dies. There are around every fifth second one child who dies. So we have more to do, and we are addressing that now.
Staggering figures, of course. Tell me why you two got on board the same idea of saving the world.
Actually, I think it was Gates who started together with the World Health Organization back in 2000. And that was just after I became Prime Minister the first time. And we looked into it, and I was so impressed by the idea of immunizing children and how good that was to do together with others. And then I saw how much money the Gates Foundation was able to put into this. And then Norway supported it, and others followed, and then this has been a great success story. And now we have moved on to also address maternal health, and we see the same kind of progress there.
How would you say, Mr. Gates, that the collaboration between Norway and your own foundation is working out?
Well, in the area of vaccines, we founded this Global Alliance for Vaccines, and it's getting the prices down, getting the coverage rates up. It's really we're both proud to have that connection to Gavi. We're also looking into maternal health. Norway has some fantastic projects down in India where they're proving out different models, and we've learned from those. We're applying those in different parts of Africa. So I think our values are the same. We both feel we're very privileged. You know, the Norwegian voters have been generous supporting these causes. I want to make sure that the The money I'm lucky enough to have goes back to help those most in need. So we find ourselves as fellow travelers on a lot of these things, and we're able to help each other quite a bit.
And I appreciate very much to work together with the Gates Foundation, because for me it's easy in a way to tell the Norwegian public that if the Gates Foundation invests their money in the project, then
Capitalists.
yeah, but the private, he's representing in a way the business community, the private capitalistic approach, and that's something very positive, because that brings in a focus on results, on cost reductions, and to be efficient. And I think really we need that in the development agenda, and therefore to work together with people like Bill Gates is some kind of double effect. We get more funds for a good cause, but in addition we get the culture, the quality. It's some kind of seal of approval. When the Gates Foundation invests its money into vaccines, maternal health, then it's very easy to tell the Norwegian people that then we could also invest our money in the same projects.
Mr. Gates, I know that you like to travel to underdeveloped countries yourself and sort of see for yourself how it works. So I've seen you talk about the horrors of the developing world. Is that something that keeps you going? Or is it your business instinct that wants you to keep in touch with the customer?
Well, I think the most magic things happen are when your heart and your head both connect. And so in my head, I know the numbers. I know that we can save lives for the least amount of money. In my heart, I go out and see the mothers, the children. When I was in Ethiopia this year, I saw that when the children were being born, the women would actually name them right away. And just 10 years ago, they wouldn't do that because over 20% of the kids were dying. And so I met.
So it was no use naming them.
Right. They would feel it was even more tragic. So they had to wait 30 days and then they would give the child the name. And so I met a woman who named her child Princess. And when she put that on the birth certificate, she said, "This is because the health care is so much better now." And so that sense of progress is very exciting. So yeah, going out, seeing what's working, it's part of what renews my commitment to the work.
And although we're talking a lot of money here, we're talking about billions of dollars, and still a little money go a long way, Prime Minister, doesn't it?
Yes, I mean this is quite cheap. I mean it's in a way hard to use that word when you speak about saving lives, but for around $30 you can fully immunize a child, and to immunize a child is a miracle. By some drops in the mouth, you have made that child, or you have saved the life of the child because you have made it, for instance, immune against polio. And so it's so simple, it's so straightforward, and therefore we have made so much progress. But also that's also the reason why we cannot accept that so many children are still dying, or for instance mothers die in connection with childbirth. The most important reason why women die in connection with childbirth is that they bleed to death. And it's quite easy to stop the bleeding. We have the medicines, they are again cheap, so it's a question of providing medicines which are already there to young mothers who die in connection with childbirth today.
You mentioned earlier today at the seminar that you both have been attending the thing that Norway is running in India, where you actually pay a woman to go to the hospital to give birth. Does that have?
Yes, because this has something to do also with empowerment of women. In many countries or in some cultures, the women don't have in a way the power to decide over their own body, and not to decide where to deliver. And we have developed in India some projects where we actually give a small amount of money for each woman that delivers at the clinic, and the money is given to the mother. That gives her power to, in a way, convince her mother-in-law, her husband, that I would like to go to the clinic, there I can deliver in a safe way, and this has proven to be quite effective. And then again we use this result-based approach, which we are also used in vaccines.
I actually went to one of those hospitals, and the husbands were very eager for the money, but so they were waiting outside for it. But that was a kind of an instigation.
But that's in a way okay. The important thing is that the women then get the power to move from the hut, from the village to the clinic, and then they will deliver more safely.
tiny babies. Mr. Gates, there are still a few very important killers among the diseases that affect children in the world. We are talking about tuberculosis still, that has not been eradicated. And it's also diarrhea and malaria. Is that the third big killer?
Yeah, those are the biggest ones. That we've only eradicated smallpox back in the 1970s. Polio, we're very close. We're down to less than 300 cases last year. And so we're putting together the plan that will make that be the second disease to ever be eradicated. Diarrhea, malaria, all those, we're getting the deaths down. We need new science. Eventually, we'd like to have a vaccine for those, tuberculosis and AIDS. And so funding the upstream science is part of will allow us to make more progress in the decade ahead.
A couple of years ago, there was some controversy around your work in Nigeria because you were investing in the Niger Delta in oil companies that actually did not help the health system there. How do you think about that situation now?
Well, I think that was saying that our investment portfolio had 0.1% in a company that had 0.1% of its activities in Nigeria, which, that's not, we're not in control of that. Nigeria is a great example of a country that has improved their health system, but they need to do a lot better. The Minister of Health of Nigeria was here in Norway. He's a fantastic person. He's gotten the president to commit to a plan to save over 1 million lives in the years ahead. So Nigeria is definitely a cup half full, but we're in there helping them make the advances. And I think up in the north, where it's been the most difficult, they are finally getting the vaccination system in place. It's also one of the 3 countries that still has polio. And so I visit on a regular basis. I'll be back there in March to look at the progress.
But the fact that your organization invested in these oil companies didn't give your work there a bad name at all.
No, there's always the question: are you going to put your energy into the invention of new vaccines and the delivery of vaccines, or are you going to think that just whichever shares in companies you buy have some big effect? And our view is that by working with these countries, that's where we have our biggest impact. We also do go to the companies, like the pharmaceutical companies, and get them to invest their resources in helping the poorest. In fact, we come out with a report every year that ranks the drug companies according to who does the best job helping the poorest. And the rankings have gone up over the last decade as they've competed for that position. Companies like GlaxoSmithKline are really quite amazing in the donations they make, putting their best scientists out there. So engaging the private sector, I totally believe in that as a model for how we can get the skills and the resources that they uniquely have.
Prime Minister is fighting child illnesses and addressing mother and child health issues, also a way of fighting poverty and making peace in a way?
Yes, of course, because to fight poverty is also to create a more peaceful world, and we have a moral obligation to try to help those people living in absolute poverty, children who dies out of preventable causes, and to reduce maternal deaths. But of course, it's also in our interest, because I'm sure that if you are able to create a more just society, a more healthy society, then we're also creating a more peaceful society. So in the long run, this is also in the interest of Norway.
Mr. Gates, do you agree with that?
Absolutely. I was concerned when I came into the field of health that if we improved health, that we'd get this huge population growth. And that's sort of a common sense. If you're saving more lives, aren't you increasing the population?
Could be the downside of it. Is that what you're saying?
Right, but it turns out it's wrong. And it's very important that people know this, that the countries that have high population growth are because of the bad health, that the parents need to have 7 or 8 children to be sure that they'll have 2 that survive to support them. And so what we see is that we improve health very rapidly, that parents choose voluntarily to have less children. And so it turns out that if you care about the environment and stability, if you want to have enough food to feed these children, working on health is actually the most dramatic way to change that. And so, I was glad when I found that out, because then we could move from just doing reproductive health into these broad health areas. And that was in the late 90s where I learned that. And that's why we're so aggressive now.
Very aggressive, but and also I would like to ask you, Mr. Gates, do you think it's an obviously a very rich man yourself, do you think it's an obligation for rich people, for example in America and elsewhere, to do the kind of things that you are doing for the other half of the globe?
I think more rich people should do it because I think they find it fun. I think they find it uplifting. I think they get to meet new people and use their skills in a fantastic way. So I don't think we should force them all to do it, but I think if we share what it can achieve, we'll draw more and more people in. And I'd like a very high percentage of the rich people to engage in philanthropy. I'm certainly sharing why I found it so fulfilling.
And some of your friends, some of your rich friends, I should say, have come on board.
Right, we created a thing we call the Giving Pledge, which is started in the United States, focused there now. And we have over 90 people who have large fortunes who've committed to give the majority away. And so, we hope that's kind of catching on as almost a role model for most people.
And Jens Stoltenberg, your Prime Minister, you obviously take very much personal interest in this work. Is this mother and child health issue something that you could think about doing full-time after ever so many years?
My plan is to win elections in September, and actually there are many reasons for me wanting that. But one reason is that I feel that being Prime Minister in Norway is an excellent platform to work also on the question of child health and maternal health.
Gentlemen, thank you very much for taking time to talk to us today.
Thank you.
Thank you.